Case of Ebola has now been confirmed here in the U.S. A doctor in New York who's just returned from Africa, CBS 58's Priscilla Luong, is live in the newsroom with the latest.
Paul, the doctor was treating Ebola patients in Guinea, a country in West Africa. He was working with the group Doctors Without Borders, and we've just learned tonight that his girlfriend and a number of his friends are now being quarantined. Dr. Craig Spencer had been self-monitoring since his return to New York, but what has many people concerned tonight, the number of people who may have had contact with this doctor. Health officials say the doctor traveled to Brooklyn and then back to Manhattan Wednesday night. Dr. Spencer reportedly took a 3-mile run, rode 2 subway lines, and took an Uber cab to get around before he began to feel sick. He reported fever and abdominal pain this morning, and that's when Dr. Spencer was rushed to a hospital where he was placed in an isolation ward. Tonight, officials in New York are scrambling to keep people calm.
We want to state at the outset there is no reason for New Yorkers to be alarmed. New Yorkers who have not been exposed to an infected person's bodily fluids are not at all at risk.
An important message there from the New York City mayor. CDC says direct contact with an infected person's bodily fluids is the main way Ebola is spread. The other way is exposure to contaminated objects like needles. The virus is not airborne, and you cannot get it through water or food legally purchased in the U.S. And just as a reminder, there are no Ebola cases documented here in Wisconsin.